Hello everyone. Very good afternoon. This is Dr. Abinaya Vijayakumar, a doctor and a motherhood empowerment coach. So very happy to do this live for the second time. And I'll wait for a few more minutes for some of you to join so that we can start answering the questions which you have asked me earlier. So I have more than 100 questions. Today I thought I would cover at least 50 questions from whatever you have asked me so far. And whatever you are commenting, I would like to answer it if time permits. So I am hiding from my son. Hello. So this is the questions that you have asked me. I have almost more than 100. So I would try to answer as much as possible, at least 50 today. Okay. So thank you so much for whoever is joining. If you are watching it on Instagram, do not forget to follow my page. And if you are watching it on YouTube, do subscribe to my channel because there I put more of long form contents where you could get an in detailed explanation for any topics. Thank you so much. So let's start. Okay, so the first question is, what should be the baby's weight at the end of pregnancy 40th week? It should be ideally around 3 kgs. Okay, and then is there appearance of, yeah, there is appearance of blue and green veins on the thigh. Is it normal? So those spider web like appearance, these are mild varicose veins, which is very common in pregnancy. If it is mild and very thin, it's completely all right. But if there is too much of protrusion along with swelling of your leg, definitely you have to reach out to your doctor and you must need compression stockings or other medications as per your gynec advice. Next, if the mother is having sugar level on border, does it affect the fetal growth organs? If it is under control or borderline, it's not going to affect the baby unless and until you have given medications and you are taking it properly. But if you're not taking the medications properly and anywhere the random blood sugar is around 300 or 400, definitely that's going to impact the baby. What would be the impact? Sometimes the amniotic fluid is going to be high, which is called polyhydramnias. Second, the baby's weight can be high. Okay, for example, if it is around 3 kgs ideally, baby would be around 3.5 kgs by term, which makes normal delivery little challenging, as well as if at all the mother is allowed for normal labor, there is high chances that baby's head may be little bigger than the body, because of which there can be challenges during pregnancy, or there can be problem with delivery of the shoulders if the mother has uncontrolled diabetes mellitus. So these can be the effects on the baby, and sometimes it can impact the glucose levels of the baby as well at birth. Next, gaining weight but belly is not showing in 7th month. Why? I have already explained this in my previous reels that belly, the baby bump, size of the baby bump has no correlation with that of the growth and well-being of the baby. If you are all right, your all parameters like complete blood count, your hemoglobin is fine, your sugar levels are fine, your blood pressure is fine, and your weight gain is good, as well as the baby is doing absolutely normal and well within the range in all the ultrasound scans, the growth is fine as well as the weight of the baby is fine, then the size of the baby bump doesn't actually matter, because size of the baby bump depends on various factors. For example, if the mother is very thin and skinny, she would have little less baby bump. If the mother is already little chubby, she would have a bigger baby bump compared to that of a thin mother. So baby bump depends on various reasons, including the fat content in the mother's abdominal muscles, in the abdomen, as well as the mother's pre-pregnancy weight, the appearance of the baby or mother, all that matters. So if the baby is fine in the scan, if the growth parameters are fine, you are fine, baby is fine, weight gain is fine, then nothing to worry about the baby bump. It has got nothing to do with the well-being of the baby. So stop worrying about it. Hi ma'am, I have hypothyroidism but my periods is normal. Chance to get pregnant. In case of hyperthyroidism or hypothyroidism, if the thyroid levels are controlled, like if you're taking medications to control it, as well as if your periods are well within the normal range, that shouldn't be a problem in the chances of pregnancy. The chances of pregnancy is affected by thyroid disorder when the mother has irregular cycles, or when the women has irregular cycles, which makes it difficult to track the ovulation. So if you are having irregular cycles, whether it is hyperthyroidism or hypothyroidism, mostly it won't have a problem in conceiving. But make sure you take it under control with the use of medications as advised by your gynecologist, because during pregnancy it should be under control to avoid any kind of thyroid problem in the baby. Okay, so sixth question is, what care needs to be taken after cervical stitches? I've already explained it detailedly in my reels as well as in the two YouTube videos, exclusively for the cervical encerclage or cervical stitches. So first and foremost, the mother can have cervical stitches for various reasons, including regular or previous history of miscarriages, repeated miscarriages, or late pregnancy losses. That is, the miscarriage doesn't happen in 8 weeks or 9 weeks but happens around 5th month. In that case, or if the mother's cervix length is short, it is less than 3 centimeters, 2.5 centimeters, then the mother would undergo cervical stitches. So once the cervical stitches are in place, it depends on the mother that for few mothers, the doctor would advise to take rest for few days and then they can do activities of daily living, normal walking around the house, doing their work, that can be done. But if the cervix is extremely short, less than 2 or 2.2 centimeters, then she would be advised to take strict bed rest apart from using the restroom or eating. Apart from that, she would advise all the time to stay on the bed rest till labor to avoid any type of complications for the stitches to hold in place. Apart from that, apart from bed rest, do not lift any heavy weights, do not engage in any sexual activity, do not do any stressful or hectic work. All that has to be taken care of, and avoid sitting on the floor. That is also very important. Next, I am currently taking folic acid 800 micrograms. Shall I continue in second trimester? When you are entering into second trimester, you would be given a combination of iron along with folic acid, which can be taken instead of just the folic acid. Why iron is not given in the first trimester? Because during first trimester, many of the mothers will already have nausea and vomiting. Iron can itself cause gastritis. So if given in the first trimester, that can aggravate your vomiting and nausea. That's the reason they don't give iron in the first trimester. So after 12 weeks, you will be given a combination of iron and folic acid supplement, which can be taken instead of plain folic acid. Next, does cough and cold affect the baby inside? Does the baby feel any disturbance while we are coughing? If it is mild cough, definitely it will not have an impact. But if it is severe cough, in a pregnancy which is more than 20 weeks, then it can cause pressure on the abdomen. So generally we would advise the pregnant mothers to keep their hands underneath the belly to support it by lifting it and then cough, so that the pressure is not directly transferred to the abdomen. And then if the cough is very severe, or if the mother is second time pregnant and had a previous LSCS, in that case the surgical suture line is the scar area is always a weak area. So prolonged cough should be avoided in such cases. Otherwise, mild cough is not going to cause any problem at all. Next, I'm 4 weeks pregnant, feeling light cramps in right side. Is it normal? Mild cramp, it's totally fine. But if the cramp is keep on increasing, it's not settling at all, and the intensity of the cramps keeps increasing, it gets worsened, then definitely you have to check out an ultrasound to ensure that the baby is inside the uterus, there is no ectopic pregnancy, and the baby's heartbeat is fine. So by 4 weeks, I take it as 8 weeks, because I think you are telling it 4 weeks from the missed periods. So it is ideally 8 weeks. So you can do a scan by this time. Next, due to what reasons does our hemoglobin gets reduced in pregnancy? Is it due to iron or vitamin B12? This also I have mentioned in one of my previous reels. Hemoglobin, even in a mother which is completely normal, the mother has around 12 grams of hemoglobin. She's not losing any blood during the pregnancy. But why is hemoglobin dropping? Because when the pregnancy is getting advanced, like 20 weeks, 30 weeks, 35 weeks, as pregnancy advances, the baby is growing multiple folds. So uterus is expanding, baby is growing, so the needs of the baby is also getting increased. In this time, the baby needs more blood supply to the placenta as well as for the baby's growth. So the same 5.5 liters of blood in the mother that has to get diluted in order to increase the quantity. This is something similar to that of adding milk to the water by the milkman to increase the quantity of the milk. So when that happens, the quality of the milk goes down, which is the hemoglobin in the blood drops down. That is the reason why mothers have a drop in hemoglobin even if they start with normal hemoglobin during the pre-pregnancy stage. So that's the reason your doctor advises iron tablets to be taken in the pregnancy along with iron-rich food items in order to avoid or in order to maintain the pregnant hemoglobin during your pregnancy. Just a minute. Yeah. Next, I'm entering 8th month. What is that? Chances of normal labor, correct? Yeah. I'm entering 8th month. Tips for normal labor. Okay. So as you are already into the 3rd trimester, I'd highly advise you to start with pelvic floor exercises if you have not already done it. So pelvic floor exercises include squats, butterfly exercise, duck walk, Kegels exercise, and all this are going to expand your pelvis such that it creates that space, opens up the pelvis, which helps during the normal labor. Okay, this helps in opening of the pelvis while the baby is coming down, and it aids in normal labor as well. This will also help in the baby's head to descend down and get engaged in the later weeks of pregnancy. So you can start with pelvic floor exercises. Second is start talking with mothers around you. Okay, because you don't know what is exactly happening inside the labor room, you go very blank, and then you get upset, or you get you get afraid for every small thing that happens inside the labor room, which is very frightening to you. So when you get prepared of what exactly happens inside the labor room, you go inside with much confidence that this is what is expected. So when you know what is going to be expected, you are in a better stage to handle that. So start talking with mothers who have delivered in the last 5 years, or if possible within the last 1 year, so that you know what they did, what happened in their delivery, what they did right, what they did wrong, so that you can take experiences from them and then you can prepare yourself. Third, visualize your labor. Every mother, when they close the eyes and start thinking of labor, they immediately feel pain, shouting, the mother shouting at the top of the voice. That's not what labor is. You can deliver baby very calm and composed in a relaxed way, even without any epidural or fancy birthing items. So that is possible when the mother is prepared enough. So you can do that by visualizing your ideal labor scene. If you want to have a calm, composed and relaxed labor where everything is under your control and you are prepared for everything and you breathe through the contractions, then you handle it better. So start visualizing every single day the ideal birth scenario in a very calm, composed environment. Next, why is there recurrent miscarriage? What is the reason? So if there is recurrent miscarriage, you have to do antiphospholipid antibody syndrome testing to rule out that there is no autoimmune condition where our own body creates antibodies against the baby, thinking that it is some external factor and it has treats it like a external antigen. So make sure you do that test. And second, check if the cervix length is good enough, and then you can also check for other factors like what exactly happens if the baby's heartbeat is not formed, or if the cervix is not holding enough, or if there is any placenta previa which happened earlier. All that can be checked. Having a detailed history, physical examination, and you can also go for this antibody testing, the autoimmune disorder which can be tested. Apart from this, 10% of early pregnancies can result in loss without any cause at all. Okay, there is no clear-cut reason why that happens. That is the reason we say some prophylactic measures like try to avoid travel in the first few weeks, at least in the first trimester, and try to avoid any heavy works or long travels. All that is advised just to be on the safer side. There is no clear-cut reason for 10% of pregnancy losses. So does pregnant mummy have tablet for cold? Does it affect fetus? So if you are taking medications for cold and cough, as per your gynec advice, it's not going to affect, because they would be prescribing medications which are safe to use in the pregnancy. But if you are taking medicines over the counter, that is a strict no-no, because many medications have counter effect on the baby growth, especially when taken in the first trimester where the organs are getting formed. So do not take any medicines apart from your supplements which your doctors advised without consulting your gynecologist, be it fever, be it cough, cold, or be it abdominal pain. Do consult your doctor, especially when it is coming to antibiotic. Definitely you have to have a check with your gynecologist to take the medications. Suggest the best food of pregnancy which increases breastfeeding after delivery. It's not like what you're going to take now is going to increase the breastfeeding later. This is two entirely different entities, and common, you have to include more of vegetables, fruits, and high protein, including, you can take chana, sundal, groundnut, or double beans, or green leafy vegetables. Any greens, you can take it weekly thrice. If you are a non-vegan, you can take mutton spleen, you can take egg, you can take daily. So all that is going to act like a foundation for your overall health and nutrition during your pregnancy. And same, if it is going to be continued in breastfeeding, that will have an impact. And breastfeeding is not entirely about your nutrition, okay? Breastfeeding is mostly about how you trust your body and how you trust your baby. It gets some time, you have to create your own rhythm. It takes some time. It's not like a tap which starts flowing immediately as soon as you give birth. It has to take some time to, the hormones has to act in the brain, and then it has to act on the breast, and then the milk is ejected. So for which the mother has to have a contact with the baby. They should have the eye to eye contact, feel for the baby. Then the maternal hormones are secreted. That is going to release two hormones, prolactin and oxytocin, which is going to imply the breast milk secretion as well as the release of the breast milk. Okay, so there is no clear cut magic drink or magic food that can, only if you take this is enough. No, you have to take a holistic food approach, and it has to include more of nutrients, the fruits, vegetables. And in mutton you can take, in non-vegan you can take egg, mutton spleen, you can have soups and salads. All that can be taken. Avoid on much of oils, spicy food, or gassy food item like tubers, which is not going to help you much with your breastfeeding, or even during your pregnancy. It is going to aggravate your nausea and vomiting. Next, ओके, दिस इज़ इन हिंदी. वेट कम क्या होता है प्रेगनेंसी में? जब भी मैंने सुना है सबका वेट गेन होता है. ओके, नॉट ऑल द मदर्स विल हैव वेट गेन इन प्रेगनेंसी. इनिशियली इन द फर्स्ट ट्राइमेस्टर सम मदर्स कैन हैव वेट लॉस. When the weight loss has to be taken care, if it is more than 5%, for example, if the mother's pre-pregnancy weight is 50 kgs, if the mother loses more than 2.5 kgs in the first trimester because of intense nausea and vomiting, then that mother would need IV medications, medicines to treat the same. Otherwise, some amount of weight loss in first trimester is totally fine. Even apart from that, in the entire pregnancy, some mothers do not actually gain weight, whereas everything else is totally fine. Their blood sugar levels are normal, their the hemoglobin is holding fine, the baby's growth is fine, the baby's weight gain is fine. So it all depends on the mother's physique in pre-pregnancy. For example, if the mother is already 90 kgs, we won't advise a weight gain of 10 to 15 kgs in the pregnancy. So she can have a healthy pregnancy even without gaining any weight when she has a balanced diet with the help of a gynecologist and nutritionist in place. So weight gain is not always necessary in all the mothers. It depends on what the mother's pre-pregnancy weight is, what the mother's physical medical conditions are, and during the course of the pregnancy, the mother and the baby's well-being will be monitored. If there is any problem with that, then that is a problem with the weight gain. Otherwise, if all the other things are holding good, this is not going to be a problem at all. Hi for everyone who have joined the live. Thank you so much for joining today. And if you're new to the channel, do subscribe. If you are seeing it in the YouTube, if you're watching it in Insta, do follow my page for regular live sessions, and planning to do it weekly once or twice. So let's see. So let's continue. Ma'am, எனக்கு மேரேஜ் ஆகி 8 month ஆகுது, ரெகுலராக பீரியட்ஸ் ஆகுது, லாஸ்ட் மந்த் பீரியட் ஆகலை. So try, if you have not got your periods, so what the doubt is, she is married since 8 months, she has a regular periods, last month she did not get her periods. So if it is more than 6 weeks, you can do a urine pregnancy test. If it is positive, you can go for a scan to confirm the pregnancy. If it is negative, you can wait for another 1 week to 10 days to repeat the test if you are not getting any periods. So once you do the test, if it is again negative, you can do an ultrasound scan to see for any PCOS or any endometrial thickness, which can be a reason which is holding you back from getting your periods. If you are pregnant, you can continue with your consultation and try to take your prenatal vitamins. So congratulations if you're pregnant. Next, I delivered my baby on 7/9/2022. Till now, I have not got my periods. Till when should I wait? You can wait, it depends entirely upon you. For example, if you are still breastfeeding your child, if you continue to be, if you're in the intention of continuing to feed at least till 2 years of age, it's absolutely normal that you did not get your periods. So lactational amenorrhea can be present in many women. That being said, some mothers can get their periods the very next month as well. So if you did not get your periods while you're breastfeeding the child, that's totally fine. But that should not be a reason why you are not using any contraceptive, because that's not going to give you 100% protection towards the unplanned pregnancy. So do have a check on your contraception to avoid unplanned pregnancies, but it's completely okay if you're continuing to breastfeed. If you have already stopped breastfeeding quite some time back, then you can do an ultrasound scan as well as a thyroid test to see if both these things are normal. Do women with sugar affect the baby development? Already I have answered this question. With uncontrolled diabetes, yes, it is going to affect the baby. Baby can be overweight. There can be little higher fluid level, which is polyhydramnias. And sometimes this big baby can have big head, which can be a problem in delivering when it is normal labor. As well as the babies can have shoulder dystocia. And they can also have the glucose levels abnormalities, either hyperglycemia or hypoglycemia at the time of birth. So that has to be seriously monitored. So why don't I enjoy sex even after 3 years of my vaginal delivery? This is completely a choice. Many mothers have loss of libido, which is loss of sexual drive after normal labor, because they have too much in their plate, taking care of the baby, sleep disturbances, breastfeeding routine, and the fatigue, tiredness, everything takes over. And so the last thing that they think about is sexual intentions. So it is completely alright. You can spend time with your partner, try to come up with ideas to bring about that spark in your relationship, but this is not a problem. But you can have a couple sitting together to think about it, to come up with various ideas to ignite the spark. So ma'am, I'm experiencing some abdominal pain during pregnancy, is that safe? Mild abdominal pain is completely fine, because your uterus is constantly expanding, especially in the early pregnancy as well as after 20 weeks, 25 weeks, where the uterus is expanding continuously. The baby is getting bigger. It is pushing all the organs away, because of which there can be muscle cramps, there can be abdominal heaviness or pain, which is completely alright. But if the pain is severe that you cannot do activities of daily living, you are bound to your bed, or if it is localized to one side, then definitely you have to meet your doctor, do a check ultrasound scan, and then you can take it ahead from there. So what can be the reasons for abnormal abdominal pain? If you are in early pregnancy, you have to rule out ectopic pregnancy, and you can also rule out any subchorionic hemorrhage if you are also having any spotting or bleeding along with abdominal pain. And then you can also look for placenta previa or low-lying placenta in case of if you are past pregnancy around 20 weeks, 25 weeks, and also rule out any placental abnormalities like abruptia placenta something. So these are some of the common reasons for abnormal abdominal pain. If it is constantly present, if it is increasing, if it is disturbing your daily routine a lot, so do consult your doctor. 21st question, when we have a short cervix at 15 weeks of pregnancy, what are the risks and how to be careful? So if you are at 15 weeks of pregnancy and your cervix is short, less than 3 centimeters or less than around 2.5 centimeter, ideally your doctor will do a cervical encerclage, which is stitching up the mouth of the cervix, mouth of the uterus, which is called the cervix. So normally it is like this. When the cervix is, normally if it is the length of this, and for you if it is the length of just only this much, 2.5 or 2 centimeters. So then as the pregnancy advances, the weight cannot be bared by the short cervix. So there is a tendency that this can open up. So what the doctors would do is they would stitch the mouth of the uterus with Vicryl such that it holds tight without breaking open. Okay, so you consult your doctor for that. Can I start? No. 7th month. Okay, right? Yeah. 22nd question. So 7th month, how many kicks should I feel? So by this time you would have a regular pattern. I would ideally not advise to keep counting on the baby's kicks, because every baby has its own pattern, and as a mother, as week advances, you will know when your baby is very active and when the baby is not. So when that routine is established, for example, my baby is very active when I get up, or my baby is very active when I go to sleep, my baby is very active and starts kicking around when I have something. So if that routine is maintained, you need not micro monitor with counts. But if you want as a per se count, I would say after any good meal, you have to have 7 to 10 counts in the next 1 hour. Okay, that should do fine. Next, I am vegetarian, 14 weeks, 60 kgs. Doctor have not recommended any protein powder. Shall I start taking it by myself? You can consult your doctor on your next visit, so to advise you on the protein powders. Apart from that, take daily protein intake in your regular diet. So you can take double beans, you can take any type of greens every single day, or at least weekly thrice, and you can take milk. If you're completely vegetarian, avoid any egg or something. But if you're taking egg, then you can take every single day. You can discuss about the protein powder along with your doctor, so that she can advise you which is safe and which doesn't have sugar content. Okay. Next, can I start yoga practice after 14 weeks of pregnancy? Definitely yes. If you are having a normal pregnancy with no complication, you can ask a word with your doctor and you can start practicing the yoga as early as 12 weeks. It's completely alright. But if you have any problems, challenges such as short cervix or repeated miscarriages in the past, or pregnancy after IVF, or cervical stitches has been done, then definitely your doctor will not advise taking any physical exercise or yoga as of now. So do consult your doctor to get your personalized opinions for your pregnancy depending on your medical condition. Next, my heart rate is going above 130. I've got fever recently. I'm 5 months pregnant. Is it normal? I must say, if it is only once more than 130 and then it comes to normal, it's totally fine. But if it is constantly above 130 and you're also feeling some kind of palpitations, like you can feel your heart pounding faster, then your doctor might advise you a medication called propranolol after checking your thyroid function test and ruling out other causes for this increased heartbeat. So you can consult your doctor, and if there is no thyroid, if you're constantly having the symptoms along with pulse count of more than 100, then your doctor will advise you propranolol tablet. Do take it after consultation. Do not take it over the counter. Okay. Next, 26th question. Can a pregnant woman have sex like normal days? Yes, sex is not a complete strict no-no in pregnancy. You can be definitely sexually active throughout your pregnancy if yours is a normal pregnancy. So far you have conceived naturally, you have not been trying for a long time, and there is no bleeding or spotting in early times. There was no threatened abortion or any abdominal pains in the earlier weeks, and you're completely fine, you're normal, doing all activities, your cervix length is good, then definitely you can be sexually active. But make sure you do not cause any direct pressure over the abdomen. So you can choose positions like that. And if you have any medical conditions like short cervix, repeated miscarriages, pregnancy after IVF or IUI, or conceived after many years of marriage, then definitely your doctor will say not to involve in any sexual activity till the follow-up scans, at least in the early pregnancy, or in some extreme cases it's a strict no-no till your labor. Only in selective cases which I've mentioned earlier. But if it's a normal pregnancy, you can be sexually active throughout the pregnancy. Next, is it okay to lay down in straight position for some time during third trimester? Yes, it is absolutely normal for lying down for few minutes, that's okay. But if you're lying down for hours together, that's not a good one. Why? Because I've already mentioned in one of my reel as well as the detailed video in YouTube. Why? Because as the pregnancy is advancing, okay, when you lie flat, your baby bump is going to fall back on the major vessels of your abdomen, which is the portal vein and the abdominal aorta. When there is constant pressure over this, the blood supply cannot be normal as before. So when this blood supply is not maintained properly, or if there is any blockage or pressure over these vessels, this will lead to decreased blood supply to the placenta and to the baby, to the uterus, because of which the growth of the baby will be affected. That's the reason the doctor says after like 16 to 18 weeks, avoid lying on the back. But for few minutes, it's completely alright. But try to change positions in between to not lie flat for a longer time. This is a doubt for many mothers, right? Next, my weight is 77 kgs in 8.5 months. Want vaginal delivery? Definitely you can have vaginal delivery. So it depends on what was your pre-pregnancy weight, how is your weight gain now. Along with that, what is your medical conditions like your hemoglobin, your sugar levels, your blood pressure, as well as your baby's well-being. If all this is fine, your height is fine, your pelvis is adequate for the baby to move down, then definitely you can have a normal labor. My wish is for you to have a normal labor as well. Then, can you tell me any breathing techniques at the time of labor? Definitely. So what you have to see is, there is a saying, okay, remember the saying throughout your labor, breathe through your contractions. This is one important saying that I kept repeating myself in my head during my labor. That is, which means it's not like, it's going to pass, it's going to pass. No, while the contractions are hitting you, you are supposed to take a long, deep breaths. For example, normally we breathe like, this is a normal breathing where no one notices. But when there is contractions, you face some kind of discomfort and pain that is happening down. So to distract you, along with bringing more oxygen to your uterus and to the placenta, what you have to do is you have to distract yourself through breathing. So you can take deeper breaths like so when you do this, all of your concentration stays into the breathing and you divert yourself from the contractions. So this also helps to bring more oxygen towards the uterus and the placenta so that the baby gets enough oxygen during the labor. Okay, when the contractions are much higher and you are not able to face the pain, you can even take short labored breathing, but start taking in breaths through your nose and breathe out through your mouth. When you do this, there is much forceful expiration compared to that of the one that I showed earlier. This shows that you have intense contractions as well, and this distracts you from the contractions, and this also brings in more oxygen. So this is called breathing through your contractions. Okay, so this has to be started from even from 7th month. Start doing your breathing exercises so that you take control of your breathing. When you are in labor, you know what exactly to do depending on your own conditions, how you wanted it to be. Next, hello akka, నాకు 5 months termination అయింది, కిడ్నీ ఫామ్ అవ్వలేదండి, ఏదైనా నా సైడ్ ప్రాబ్లమా? సో this mother wants to know that she had a termination at 5 months of pregnancy, that it was said that the baby's kidney was not formed, agenesis of kidney, fetal kidney. This is not a problem from your end. That is the reason why we do anomaly scan, to see for any of such arising problems in the baby. Why we do it in 20 weeks? Because that is the week that we can go for termination of pregnancy if there is some major problems in the baby. If it is minor, it can be taken care well ahead from the 20 weeks of pregnancy. We know what to do and what to expect. If it is major life-threatening conditions that the baby cannot survive, we can go for termination of pregnancy. That is the reason we do anomaly scan at 20 weeks of pregnancy. So this is not a problem from your end. So please don't worry about it or stress about it. Take time to heal from this pregnancy loss. At least 6 months, I would ideally say, because your body, your mind has gone through a lot. Take this space. So this phase is very much essential for you to get back to your own self in order to plan your next baby. Your next baby is not a substitute for this baby. Okay, many mothers focus on getting pregnant quicker after a pregnancy loss. That's not going to help you, because this is not a substitute for that baby. I know you are very anxious to conceive, but having a healthy pregnancy, having a healthy child is very much more important than having a child. There is a major difference. So if you want to have a healthy you, healthy child, healthy pregnancy and a normal labor, then have a gap of at least 3 to 6 months. I would ideally say 6 months after a pregnancy loss if it is like more than 12 weeks. Okay. Next, 31st question. We have covered 30 questions. So 31st question, I'm 3 months pregnant. Women always, pregnant women, always I feel like vomiting, not eating well. What can I do? It's completely normal in the first 12 weeks to have nausea and vomiting, because that is the time your beta HCG is little higher. I've already posted one video exclusively for nausea and vomiting in pregnancy on my YouTube channel. My YouTube channel name is Dr. Abinaya Vijayakumar. You can go check it out, subscribe to my channel and start watching the long form contents so that you get in clear explanations for all the same. To answer your question, in the first 12 weeks, the beta HCG level is going to be higher. That is the reason why you are having nausea and vomiting. But after 12 to 14 weeks, the placenta takes over, giving nutrition to the baby, after which this beta HCG drops. So the mother, while they move from first trimester to second trimester, they feel little better with nausea and vomiting. So in the first trimester, it's completely alright. So some tips that can help you is try to split your meals. Instead of taking 3 major meals, try to have 5 to 6 smaller meals at a frequency of at least 2 to 3 hours. Take less oily, less spicy and less gassy food items. That's very important because that's going to aggravate the nausea and vomiting. So try to avoid those. You can have hot water before and after each meal. Try to walk for some time after each meal. Do not immediately sit down or lie down after any meal. Okay, that's going to aggravate things. And then do not be in your empty stomach. If you're going to be in your empty stomach, the acids from your stomach along with beta HCG, it's going to aggravate your nausea and vomiting. So these are some of the tips that can help you. But if you have severe vomiting, if you puke for every water intake as well, then you would ideally need IV fluids to correct the hydration along with medicines, antiemetics to control the vomiting. So do consult your gynecologist for such medications. Next, we are not able to conceive naturally after a miscarriage 3 months ago. As I've told earlier, this is just 3 months after a miscarriage. Do not plan your pregnancy in a hurry. You need to come back to your own self to take care of the baby during the next pregnancy. So ideally give a gap of at least 3 to 6 months. You say that you are trying for 3 months, which means you have not given a gap at all. This stress itself affects the quality of sperm as well as the egg, and this also interferes with the chances of getting pregnant. The mother and father's anxiety, especially the mother's anxiety during ovulation, during intercourse, during the egg release, that has a great impact whether or not it's going to turn into a pregnancy or it's going to turn into a menstruation. So if you are stressful, this is not going to help you with your pregnancy. Second thing, I would not ideally recommend you to plan your pregnancy within a short span. Give it at least 4 to 6 months time. So you have been keep trying, which means you have not at all left a time gap after the last miscarriage. So your body needs to come back after the loss. Your mind needs to come back to the self after the loss. So give it some time. You can try naturally during your ovulation, your ovulation period using calendar method if your regular cycles. But if you are not getting results or if you are very anxious to conceive, then you can consult your gynecologist for a follicular study so that they can track the growth and maturity of follicles and release of ovum, such that you can be sexually active during those ovulation days. It can increase your chances of pregnancy. Okay, do consult your gynecologist. Next, white discharge and whole pregnancy. There is an exclusive video on vaginal discharges, especially white discharge during the pregnancy, on my YouTube channel. Do check it out for clearance sake. If it is thin watery discharge, it's completely alright. This is because of pregnancy hormones. This is not going to have any problem at all. But if it is thick curdy white discharge or green discharge or brownish discharge along with foul smelling, along with itching, then definitely you have to rule out any vaginal or cervical infections. So do consult your doctor to check for the same and to take medications for the same. Next, ma'am, my hemoglobin is 9.9. How can I increase? So it depends on your weeks of pregnancy. If you're early in your pregnancy, less than 12 weeks, you have got some time. So start with your dietary modifications. Include weekly thrice of greens, and then mutton spleen if you are non-vegan, and try to include more of vegetables and fruits during the pregnancy, as well as pomegranate, dates, fig, which is also going to increase the hemoglobin. If you are in second trimester, then if it is more than 20 weeks and if your hemoglobin is less than 10 or 10.5, ideally the doctor would advise you to take iron sucrose injections. It is a IV medication which is given once daily or once in alternative days. They give total of 8 shots depending on your hemoglobin. For 9.9, somewhere around 4 doses will be enough. So you can consult your doctor on the same. If you are anywhere after 30 weeks, 37 weeks, 36 weeks, nothing can be done during this phase. You just have to continue with your dietary modifications, your diet intake along with your iron supplements. So, and if you could take mutton spleen every single week, weekly once or twice, that's totally fine. At least take it till delivery, because mutton spleen is very much rich in iron content. Okay. Next, I am 7th month pregnant. AFI is 8. Doctor said it is low. Tips to improve AFI and anything to worry. AFI is definitely low. Anywhere less than 8, anywhere less than 9, we say oligohydramnios, which is low AFI. And if you are in 7th month, first your doctor would advise you L-arginine sachets, Astamin 4 tablets, along with sometimes some doctor would give you IV medications, IV fluids, maybe 1 point. And also increase your water intake. If you are not taking in too much of water, please take in at least 3.5 liters of water every day. Along with that, you can include much of soup, tender coconut water, juices, fresh juices, all that can be taken, or rice fermented water. So rice fermented water, if taken on the next day, that's going to act as a rich source to increase your amniotic fluid index. So I would highly recommend it to take it along with a pinch of salt. 2 glasses each day till your labor, to be on the safer side. You can start from 7th month even if your AFI is fine, to maintain it on the same. Next, is weight reduction very important to conceive? Again, one second. Again, it is about, just give me. So weight reduction, yes, it is very important to conceive. Just give me a minute. யாரு தாத்தா இல்ல இப்ப திறக்க முடியாது, கிளாஸ்ல இருக்கேன். Very sorry. Okay, so very sorry about that interruption. Yeah, so is water, what did I was saying? Yeah, it's water. Yeah, weight reduction very important during conceiving. Ideally, it's not like the chubby kids or the chubby women cannot get pregnant. It's not that. First, you have to see if your periods are regular. Okay, if your periods are regular, then this is not the reason why they ask you for weight reduction. If you are little chubby, the weight is high, your periods are irregular, your thyroid is abnormal, or your ultrasound scan shows polycystic ovaries, then that's going to be a problem with you conceiving. So that is the reason in treatment of PCOS, it is always 3 approaches together. It's a triangular approach where medications has to be taken care of, lifestyle modification like any form of exercise or walking has to be incorporated to reduce your weight. Third, dietary modification has to be done. Do not take in any junk, packaged item, junk, oily items has to be avoided. Take in more of vegetables, fruits, take in lots of water, and that is going to improve your diet helping in weight loss along with your physical activity, along with medications. So if all this three elements of triangular approach is maintained for at least 3 to 6 months, PCOS gets cleared or comes under control, then you can start having your regular periods. So once you have regular periods, you have a chances of getting pregnant. But if you're already having a normal periods, regular periods, why is the doctor advising you weight reduction? It's not about the stigma. Let me get this straight to you. This is not about the stigma. During pregnancy, anywhere you will gain at least 10 to 15 kgs of weight. So if a mother is around 60 kgs, if she gains weight, she would be around 70 to 75 kgs at the end of pregnancy. But if the mother is already 100 kgs or 95 kgs or 89 kgs, if the mother is again going to get weight gain weight during the pregnancy, that is going to pose threat during your pregnancy on your health as well as on the baby's health. So that is going to be a problem. So as I always say, getting pregnant is not very important, but having a healthy pregnancy is very important. So if you are anxious to conceive, I would ideally say reducing your weight to little ideal weight before planning your pregnancy. This will help you maintain your weight gain, regulate your weight gain during the pregnancy, such that you don't have any medical conditions, or your baby is also totally fine, you are also totally fine during your pregnancy. So having a healthy pregnancy is very much important than just conceiving. So get this in mind before you think about stigma and other things. I'm not talking about anyone else. This is just about you. This is about your pregnancy. This is about your baby. So ideally, yes, I would advise you to reduce your weight a little bit if you are overweight, and then plan your pregnancy so that when you gain weight in your pregnancy, that is not going to cause any challenge during the pregnancy for you or for the baby. Okay. Next, with bicornuate uterus, I delivered my first baby 24 days early. Will it be the same with the second pregnancy? This cannot be predicted. This cannot be predicted. Not just with the bicornuate uterus. Anytime during the pregnancy, if you had a preterm or little earlier delivery than the expected date, there is a chance that you can have the same during the second pregnancy. But it is not a hard and fast rule that you will definitely have it 20 days or 30 days earlier. It's not the case. Okay, so it is not a rule, but there are chances 50-50. So we cannot predict on that. We just have to wait and watch. 40th question. Will milk be sufficient for 8-month-old child while the mother is 3 months pregnant again? Yes, you can continue to breastfeed your child even up to 2 years of age while you are still pregnant, and while you have the second baby, it is still possible. You can continuously feed both your babies together. Your baby is just a newborn and your second baby, your first baby is around 2 to 3 years old and you just delivered a baby. Still you can continue to breastfeed both the child. It is possible, but it takes a village. Okay, the mother has to be composed to do this. If the mother is not confident enough or composed enough to handle this, there can be cluster feeding in the first one, cluster feeding in the second one, and this is not going to reduce the milk for the second baby. Our body is designed in such a way by God that even if we deliver 11 kids at the same time, 11 kids, 12 kids, we can still exclusively breastfeed all the 11 kids. But the problem with our society is we are too soon to be judged. As soon as a mother gets, the mother delivers, within few hours, I get a call from my nurses saying that the mother is not having milk. The mother is having only few droplets. The mother is not at all producing any milk, not even a single drop. Just give some time. If you're not going to give that time for your body to act, and you are going to be immediately stressed about the fact that you're not having milk, your confidence level goes down, you're not able to connect with your baby, you're very stressful under that situation. That in turn is going to act or take a toll on your prolactin or oxytocin levels. So that will reduce the breast milk supply. But when you trust your body, trust your baby, you can continue breastfeeding your first child during your second pregnancy and even after the second child is born, while you can simultaneously breastfeed both the child. You have to be confident enough and you have to hold it together. It depends on the mother and the family, especially the family, because if the family is supportive enough, everything is possible for a mother. But if there is no good family support, the mother is going to face all that alone, which is very, very dreadful and traumatic. So Family support during pregnancy and postpartum plays a very essential role, especially in breastfeeding, how long the mother continues to feed the child. That is especially based on a supportive family. Next, there is no itching on my tummy, but I see some blue lines on lower abdomen, 29 weeks pregnant. Will it disappear? These blue lines, what you see, is completely physiological. This is completely normal during your pregnancy. This is one physiological change which happens in some mothers. Not all the mothers will have blue lines. Some will have that dark and black lines, but blue lines can happen because of the stretching of the muscles and stretching of the vessels. This is possible and it is completely normal, nothing to worry at all. So you can just monitor it, and probably it fades away after delivery once the baby bump comes down. Next, 42nd question, any exercises for low lying placenta on the 36th week or low posterior placenta? There is no exercise. For placenta previa, low lying placenta, there is no exercise at all. Nothing can be done about it. No medications can take it from the lower end to the upper end. All that you can do is just simply wait and watch. During the initial weeks, we will have to wait and watch, because as the uterus is constantly expanding, there is a chance that the placenta can rotate itself to the upper end. That is possible. So that is the reason why mothers who have low lying placenta by 12 weeks, they get completely fundal placenta by 20 weeks or 28 weeks scan, which is possible because the uterus is expanding. But you have mentioned it as 36 weeks. There is no exercise that is going to help you out with this. Mostly, if it is complete placenta previa, your doctor would advise to go ahead with a C-section. But if it is marginal placenta previa, and if your doctor is experienced enough, sometimes they may allow for a trial of vaginal labor, with the caution that during the labor contractions, if placenta comes in the way of the baby and see, your uterus is like this. So usually your baby is here and the fundus, the upper end, is where the placenta is attached. Okay, so imagine like this. So here or here is where the placenta usually gets attached. This is the fundal area. But for some mothers, it can be attached in the lower region, here or here. So during labor, when the cervix opens up, there is a chance that this placenta can come before baby and start masking the outlet of the uterus. So there immediately the mother will be taken up for C-section. So ideally, low lying placenta previa, in 36 weeks the doctor would advise you to go ahead with a C-section. In some marginal cases, they can allow you for a trial of labor, with a caution that you will end up in a C-section if placenta comes in the way of the baby. Okay, I think it is clear. Okay, the 43rd question, at what week if baby delivered is normal? After 37 completed weeks, not 37 starting weeks, 37 completed weeks. So 3 weeks due to your due date. Okay, anytime we give your expected delivery date, due date, we say plus or minus 15 days. That is because this due date is just an approximate calculation, and no one in the world can predict that definitely the baby will be delivered only on the labor day. Only 10% of the babies get delivered on the labor day, but otherwise plus or minus 15 days. Usually in countries like India, we don't allow post-dated pregnancy. We can have labor anytime after 37 weeks, which is completely term. Okay, so 37 completed weeks is good to go for a normal labor. Next, or even for C-section, if it's a repeat section, they don't wait till the labor date. They usually take it 10 days or 15 days before due date. Next, low posterior and in breech position. Low posterior, what is that? Breech presentation in 36 weeks, definitely your doctor will not wait further. If it is primary mother, maybe your doctor would advise you to come again for another scan at 37 weeks or 38 weeks. Okay, so then you have to do, just give me a minute. இல்லை நான் கிளாஸில் இருக்கேன், ஒரு 10 நிமிஷம் அதான் சொல்லி தான் அனுப்பிச்சேன் அவர்கிட்ட. Sorry. Okay, so 37, yeah, what was I saying? Yeah, so breech presentation, if it is your first baby, your doctor is not going to allow you if it stays the same way after 37 weeks. Some doctors might advise you to come for another scan by 36, 37 or 38 weeks to decide if it is still breech. They would ideally plan an elective C-section. They will not wait further in a primary. In second time mothers, there is a chance for the baby to move around or the head engagement to happen in the late weeks as well. But the final presentation usually is considered around 37 to 38, maximum 38 weeks in private scenarios, in corporate hospitals where all the facilities are available. But if it is still in breech, definitely the doctor is going to advise a C-section, and that is the best choice for you as well as for the baby. Next, what is the right age for the baby to stop breastfeeding? There is no right or wrong in this. The minimum requirement is you have to exclusively breastfeed the child for first 6 months of life. That is exclusive breastfeeding. No water, no other food, nothing. Okay, your breast milk contains everything starting from water, nutrients, protein, calories, fat, everything. So first 6 months you are going to take only breast milk. Okay, you're going to give only breast milk for your child. Then you can continue feeding at least till 2 years of age as per WHO recommendation, recent guidelines, which is very, very good for the baby. But if you are willing to continue breastfeeding even longer, it is totally fine. However long you give, the baby is going to get a lot of benefits because of it. It's going to act as a long immunity booster for the baby, and it's going to be a lifelong immunity for them. So it's totally fine even if you continue to breastfeed till 3 years or 5 years. Depends on you, your baby, if the baby is willing to take, and your family situations and your family support. Okay, next, my WBC count is around 15,000. Is it impacts anything? Yes, definitely. WBC count of more than 11,000 implies there is an active infection. Okay, so if you're not having any symptoms, then the most common thing that happens in pregnancy is urinary tract infection. So we would ideally do a urine routine and culture to see if there is any infection or bacteria present, and if so, we can treat it appropriately. But if you are having any symptoms like recent cold and cough, fever, that explains this. Okay, so you have to take necessary medications for that infection for this WBC to come down. Next, presently I'm 37 weeks pregnant. How to identify labor symptoms? So labor symptoms, true labor symptoms is something like if you are having tightening of your abdomen, the pain starts from the back along with the tightening of your abdomen and then getting relaxed after few minutes. Initially, this contraction relaxation will come anywhere for 10 seconds, 15 seconds, and then it relaxes. The next contraction will come after 5 minutes or 10 minutes or 15 minutes. As time passes, the gap between two contractions gradually reduces, and each contraction duration, the tightening time, is going to be little longer than before. For example, 15 seconds become 30 seconds, 30 seconds become 40 seconds, 45 seconds. Then it is a true labor. So as time advances, if it is intermittent contraction and relaxation, and if you wait for another 1 or 2 hours, the time gap between two contractions is gradually getting reduced. You get one contraction in 10 minutes or 15 minutes in the starting stage. After 1 to 2 hours, you are getting contraction once in 5 minutes, which means it can be a true contractions. And the longer the duration of the contraction, it may be a true contraction. Okay, initially it was 10 seconds, now it is 15 seconds, 20 seconds. Then it can be a true labor symptom. Along with that, if you have any bloody discharge, which we call it as show, that can be a symptom of that you're going into labor. Next, if you're having thick plug-like discharge, it's like egg white slimy discharge, that is called the mucus plug. Your cervix, when it is closed in pregnancy, there is a plug-like thing which is formed, which is like, it is like the corkscrew in the bottle. So it is just blocking it. So when this is coming out, that means the cork has been opened. So now the bottle is ready to blow. So you are ready to go into labor. So anytime you have a mucus plug like discharge, that is the white thick egg white like discharge, or you're having some bleeding or spotting or bloody discharge or intermittent contractions which is getting longer every time, along with quickening movements or less baby movements, more baby movements, or any leaking of fluid. Okay, you feel like you are going to restroom, but within the next 1 minute, 2 minutes, you are constantly going to restroom and coming back, passing few fluids, your underwear is getting wet, that could be water leakage, which is a sign that your water has broken, or sudden gush of fluid as shown in television. So these are the symptoms that you're going into true labor. Next, I'm 9 months pregnant. Today took sugar test and my blood sugars are low. 63 fasting, 78 after postprandial. This is completely okay if you're not having any symptoms like giddiness or anything. Okay, this is completely alright. We have the problem only if it is too much high, or if you're already a patient of gestational diabetes. If you are a mother with pregnancy induced diabetes mellitus, you're taking medications and suddenly it is dropping down, then we need to adjust the medication. If you're not having any sugar complaints at all, this is completely alright and nothing needs to be done. I'm 19 weeks pregnant with anterior placenta, feel very less movement. It is normal. Is it normal? Yes, it is normal, because here the placenta is anterior and the baby is behind the placenta. So whenever the baby moves initially, those movements will be very light in the 20 weeks, 19 weeks, 22 weeks and all. But as the pregnancy advances, like 24 weeks, 28 weeks, then you can have much intense movements which can be felt easily even if it is anterior placenta. As of now, it is very early and it is completely alright. Next, hello ma'am, double cord around the neck can impact the normal labor. Yes, definitely the doctor will not advise normal labor in case of double cord. If it is single loop of cord, the doctor might advise for a trial of vaginal labor. But even then, anytime during the labor, if the mother is having any symptoms like if the baby's heart rate is going down, or if the mother is having any blood pressure issues, then immediately the baby would be the mother would be taken up for C-section. But if it is double cord around the neck, there is a high chance that the baby can go into distress during the labor, that the cord can tighten around the neck. So in such case, the doctor will not take the risk. Definitely they would advise an elective C-section. So double cord or triple cord, there is no question of doubt. Next is HB 8.4 too low. How to instantly increase it within a week? There is no magic trick. You need to undergo a blood transfusion. Even then, it has to be less than 7.5 in order to qualify for a blood transfusion. Usually they do blood transfusion to a antenatal mother only if the HB is less than 7.5. So 8.4, they don't advise blood transfusion, but you can go for iron infusions, iron sucrose infusions like 8 doses or 6 doses, and then counter check the HB after 2 weeks after the last dose. Okay, so instant increase cannot happen because this is not a magic. This is something logical. Okay, you need to think from logic point of view in pregnancy, and there is no magic happening. Along with this iron sucrose infusion, diet. Okay, you have to take a iron rich diet intake and your medications, iron rich supplements as advised by your gynecologist. All these three has to go hand in hand. If you have not dewormed earlier yourself, you have to deworm. Consult your doctor for albendazole tablet. You can take it because if there is worm in the stomach, if the mother is taking everything but still the HB is dropping, because the worm is getting everything from your food and you're not getting any nutrients. So deworm yourself if you haven't done it earlier. Next, there is so much more. I will try to see if I could answer some more from the recent questions. Just give me a minute. So hope many of your questions got answered. Thank you so much for each one who have joined this session. If you are new to my page, follow my page. Very big hi to everyone who have waved the hand. And if you're watching it in YouTube, which I'm going to be uploading soon, please do subscribe to my channel so that you get more such informative videos. Just give me a minute. Last few questions. There are so many more questions. I cannot cover more than this in one live session. So I'll try to do another live. Next live, probably we would come with any topic of discussion rather than just answering the question. Maybe we can have it like this. One, we can discuss any topic in pregnancy, and another live, alternative live, can be answering the questions. Is that good? Just let me know if that is okay with you. Give me a thumbs up and do share this page with your friends and family who has any mother who is planning for pregnancy, who is pregnant, who is going to be delivering the child, so that they get benefited out of these videos. Thank you so much for each one of you joining today. Means a lot. And yes, just a couple more questions. I think I've answered more than 50, but I'll see. Hi to everyone. Okay. Yes. Okay, so some other questions which I couldn't see right now because I'm live. Last few questions maybe I will cover it up in the next session because I thought I could see from my laptop and then I can start answering those questions at the very end. I've already made a list of around 100 questions which you have asked me earlier. So the people who have asked me, the mommies who have asked the doubts in yesterday night and today morning, I would make a note of it and I would answer it either through stories or in the upcoming live session. And if you have not joined the silver membership of Get Mommified Hub, I would like to tell you that there is a webinar that's happening on Tuesday at 7 p.m. Tuesday, what is the date? 22, 23, 24? Yeah, 24 at 7 p.m. So do join me for that session. If you're interested, let me know in the comments and let me know in the DMs, message in or yes, I'm interested, so that I can send you the link to register and I can meet you inside the webinar. You will understand 3 secrets to have a happy pregnancy and an intelligent child. And at the end of it, you will know what all you can watch inside the post-pregnancy bundle. Okay, what all courses, what all is covered and why is it so important, why is it so unique from other courses. And you will get the jaw-dropping price of 2,500. You pay for one course and you're going to get a bundle of 8 courses free. So for you to get a little oriented about what you can expect in the course so that you can decide whether or not this course is for you, do join me on Tuesday's live masterclass happening at 7 p.m. in Zoom. So do let me know if you're interested. Message me, I'm interested, and I'll send you the link to register. So thank you so much for each one of you joining today. I think I've covered more than 50 questions today, and I will be posting it shortly in the YouTube as well. If you have not watched it, you can go and watch it in YouTube. If you are watching it in YouTube, do subscribe to my channel and press on that notification bell icon so that you don't miss out on any new upcoming informative videos. And there is going to be regular videos on pregnancy, motherhood, breastfeeding, labor management and much more. And there are also expert sessions coming back to back. We are planning a shloka session, importance of shloka in pregnancy. That's going to be happening very soon, maybe in a week time in our community. So if you want to attend all of these, don't want to miss out on these golden nuggets in your pregnancy, then please join us at Get Mommified Hub. It is still an offer price of 2,500 rupees. I'll post the details in the story. If you feel this live was very informative and you understood many more things, you got many of your doubts answered, then positive pregnancy bundle is going to answer a ton of your questions in mind which you have never asked before, which you have never told out anyone, because I've read each and every one's mind. I have been a mother, I know exactly how it's been, and I have a community of 500 plus mothers. So do join the India's fastest growing motherhood community and be a part of this before you regret your decision for not joining. Okay, thank you so much for all the persons who have joined today, all the mommies, all the daddies who have joined today, and meet you in another interesting live. Thank you and have a beautiful Sunday and advanced Ayudha Puja and Vijayadashmi wishes.